What are id, ego, and superego in depression psychodynamic therapy? Have you ever wondered how our inner selves influence our feelings and behaviors, especially when it comes to depression? The concepts of id, ego, and superego, introduced by Sigmund Freud, play a significant role in understanding our mental health. These three parts of our psyche interact in ways that can impact our emotional well-being. Let's break it down. The id is the part of our mind that is present from birth. It represents our basic instincts and desires, seeking immediate satisfaction without considering the consequences. Think of it as the child within us, wanting what it wants right now. The id operates unconsciously and is driven by biological urges like hunger and aggression. Next, we have the superego. This part develops as we grow and internalize the moral standards and values of our parents and society. The superego acts like a strict parent, guiding us with rules and ideals. It produces feelings of guilt and shame when we stray from these internalized standards. It strives for perfection and often judges the actions of the ego. Now, the ego is the mediator between the id and the superego. It operates on the reality principle, making decisions that are realistic and socially acceptable. The ego tries to satisfy the id's desires in a way that does not provoke the superego's punishment. It balances our primal urges with moral constraints and the realities of the world around us. In the context of depression, psychodynamic therapy views symptoms as arising from conflicts among these three components. For instance, if the superego is overly dominant, it can lead to excessive self-criticism and feelings of worthlessness, which are common in depression. The ego struggles to manage the harsh demands of the superego while also addressing the id's impulses. This internal conflict can result in anxiety and distress. Defense mechanisms come into play as the ego tries to manage these conflicts. These are unconscious strategies that help reduce anxiety. However, in depression, some of these mechanisms, like repression or denial, may actually maintain depressive symptoms. They prevent us from processing painful emotions and conflicts. Psychodynamic therapy aims to bring these unconscious conflicts into conscious awareness. By understanding how the id, ego, and superego interact, individuals can gain insight into their feelings of depression. This therapy supports strengthening the ego's ability to balance these forces effectively, reducing reliance on maladaptive defenses. Therapists work with clients to uncover early life experiences that shape their superego's harsh standards or their ego's vulnerabilities. This process helps clients understand the roots of their depression and develop healthier ways to manage their internal demands and external realities. By addressing these conflicts, individuals can work towards emotional healing and a more balanced state of mind.